Good morning.
Welcome to our OET speaking channel, SOANZ Hub.
Today, we are going to discuss about sepsis.
Let's go through the task. You will get 3 minutes to prepare the roleplay.
Setting: Hospital Emergency Department. You are speaking to a 30-year-old man who was treated for skin cancer a year ago. Now, he came to the emergency department via ambulance. He presented with loss of consciousness, breathlessness, fever, slurred speech, low urine output, low blood pressure and increased heart rate. The blood tests are done and it shows sepsis. The doctor requested you to talk with the patient to get admitted in the hospital for antibiotic treatment.
Task 1. Greet the patient and obtain his personal details. 2. Ask what actually happened. 3. Ask about the signs and symptoms he experienced. 4. Explain about the blood results and abnormal vital signs, for example, positive blood culture, decreased platelet count, increased INR, low blood pressure, high-grade fever, low respiratory rate and high heart rate. 5. Explain what is sepsis. Life-threatening condition, tissue and organ injury. 6. Explain the need and importance of antibiotics. For example, bacteria present in body will be destroyed by antibiotics. Immunity can be regained as he is immunosuppressive. 7. Explain the need of hospitalization, for example, IV antibiotics and its course, close monitoring, complications, availability of emergency access.
Let's start the roleplay.
Good morning.
Morning.
My name is Helen. I'm one of the registered nurses working in this hospital emergency department.
Hi, Helen.
For confirmation, may I know your name and date of birth? Please.
My name is Patrick. And my date of birth is the 25th of November 1991.
Thank you, Patrick. How are you feeling now?
Much better than before.
If you don't mind, could you please explain what actually happened to you?
Nurse, as you know, I was on treatment for skin cancer a year ago. Today, when I was watering my plants in the garden, I felt unwell. My heart was beating faster, I can't hold my breath, my hands and feet were so weak, I was not even able to call for help and I fell down. That's all I remember. And when I wake up I was in the ambulance.
All right. I'm really sorry to hear about that. Anyway, don't worry, Patrick, you are in the right place. We will take care of you. Before proceeding further, for better understanding, could you please tell me that? Did you felt any other signs and symptoms?
Actually, I was having high temperature for the past 2 days, accompanied with breathlessness, tiredness, decreased speech, very low urine output and weakness. I thought all these will be because of my weak immunity. I was so worried about myself.
Patrick, I do perfectly understand your situation. But there are many people that I know who survived from cancer. Cancer is a curable disease. So, don't get worried about that. And, look, as per the documents I'm having, your cancer is fully treated and cured. Don't get upset about yourself. We all are here to help you and we will.
I know, and thank you for the support.
Anyway, as per the blood tests we have done today and vital signs that has been checked are showing some abnormalities. Your platelet counts and urine output as well is low. Also, you are having high-grade fever, low blood pressure, breathlessness and abnormal heart rate. The blood samples are indicating infection. You are having a condition called sepsis.
My God, am I weak again? What will I do now?
There is nothing to be worried about. Sepsis is a treatable condition. Here we will provide adequate treatment and we will help you to overcome from this situation. If you don't mind, I will explain what sepsis is. Can I?
Yes, sure. I don't even have an idea about this.
Well, I'm glad to explain that. Sepsis means it's the body's response to an infection that causes injury to its own tissues and organs. The immune response in the body is triggered by an infection. It can be a rapid or prolonged response. Mostly, it's seen in immunosuppressive individuals. That means those who are having low immunity to fight with infectious agents or viruses. So, we can say that it's a life-threatening condition. But early diagnosis and appropriate treatment can cure sepsis. Are you able to understand what I'm saying, Patrick?
Yes, I do. So, what are the treatment measures?
Normally, as per the blood culture results, we will start with intravenous antibiotics. Also, we'll recommend symptomatic treatments. The antibiotics will help to destroy the bacteria or the infectious agent and plays a vital role to restore the immunity in the body. In your condition, as you are already immunosuppressive, it is really necessary to get antibiotic treatment. Are you following me?
That's right. But, if it's possible, can I come tomorrow to the hospital? So that we can start the treatment from tomorrow onwards.
Look, Patrick, as I mentioned earlier, your immunity is very weak and the infection is spreading rapidly. So, as per the doctor's advice, it's better to start the treatment as early as possible. We would recommend to start the antibiotics from today onwards. As it's a life-threatening condition, we need to monitor you closely. Also, in case of any emergency, here in the hospital we have all the facilities. Did you get my point?
Yes, nurse.
Patrick, I know how hard it is to go through such situation. But, here we have well-trained and excellent staffs who will take care of you and will definitely provide appropriate treatment. If we are not treating the infection, it may lead to further complications like temporary or permanent organ damage, multiple organ dysfunction, and it will cause death. So, please stay in the hospital until the course of antibiotics are completed. How that sounds?
All right. So, I think it's better to stay in the hospital and start the antibiotic treatment. Isn't it?
Definitely. I appreciate you. That's a good decision. So, now I will arrange all the documents for hospitalization and get back to you. Is that okay?
Yeah. That's fine.
Do you have any other queries?
No. You have cleared everything.
Well, please wait here. I will inform to the ward nurse regarding the admission. Meanwhile, if you want anything or for queries, please press the bell on the left-hand side of the bed.
Okay, nurse.
Thank you for the cooperation, Patrick. I wish you a speedy recovery.
Thank you, nurse.
Take care.
You too. That's the end of your speaking session.
For more videos, please subscribe our OET speaking channel, SOANZ Hub, and press the bell icon.
Also, comment your suggestions and share with your friends.
God bless you.